Good afternoon and welcome to the National Hispanic Council on Aging's first series of Tele-Town Halls, Empowering Communities, Improving Population Health. My name is Christina Pacheco and I am NHCOA's Director of Resource Development and Policy, and it's my pleasure to be moderating today's Tele-Town Hall. Due to the ongoing COVID-19 pandemic, the National Hispanic Council on Aging is developing innovative ways to continue engaging, informing, and listening to communities. For 51 years, NHCOA has worked to improve the lives of Hispanic older adults, their families, and caregivers. This year is no different. During today's Tele-Town Hall, you will hear from experts who will provide information about the importance of participating in health research, specifically for Hispanics, and to educate our communities about the novel coronavirus, COVID-19, and its impact on older adults, their families, and caregivers. The format will consist of 2 panel presentations, followed by a facilitated discussion at the end of each panel. NHCOA's Tele-Town Hall could not be possible without the generous support of our many sponsors. We would like to thank the All of Us Research Program, the Hogg Foundation for Mental Health, Pharma, Lyft, AbbVie, AARP, and Lilly. All right. Can we unmute Dr. Cruz?
Yeah.
Okay. I am pleased to welcome the President and CEO of the National Hispanic Council on Aging, Dr. Yanira Cruz. She is one of the nation's foremost advocates and spokespersons for diverse older adults and has been recognized for her commitment and leadership on behalf of diverse older adults nationwide. Welcome, Dr. Cruz.
Dr. Cruz.
Some issues with her sound.
I unmuted her, so.
Okay, so we will continue, and then if she is able to get her sound to work, we'll have remarks from her. The administration of healthcare in the United States is not equitable. This leads to poor health outcomes for marginalized communities. Creating an equitable healthcare system for aging Hispanics in all underserved communities starts well before an individual gets sick or goes to a healthcare facility. The foundations begin with health research itself. While Hispanics make up approximately 17% of the US population, they only comprise about 1% of of clinical trials participants nationwide. To compound this problem, clinical trials typically only include adults up to the age of 64. This means that treatments and prevention strategies are rarely developed with our communities in mind, and this is not a new problem. The lack of minority representation in clinical trials is an ongoing source of health disparities for patients of color. The persistent lack of attention to addressing the representation gap runs the risk of further widening the divide in socioeconomic disparities related to health. The All of Us Research Program is attempting to address these disparities by inviting 1 million people across the United States to help build one of the most diverse health databases in the history. Participants from all backgrounds are welcome, and researchers will use the data to learn how biology, lifestyle, and environment affect health. This could help them develop better treatments and ways to prevent different diseases. I will briefly provide information on the All of Us Research Program. Natalie, can you pull up my slides, please?
Can you see it?
No, I just see the Tele-Town Hall.
Can you see it now?
No.
What? It says it's showing. Hold on.
Okay, there I see it.
See it? Okay.
Yep. So if you can go to the third slide. So the National Hispanic Council on Aging is partnering with the Community and Provider Gateway Initiative, or CPGI, funded by the National Institutes of Health, All of Us Research Program. CPGI is a network of community-based and provider organizations across the United States that supports the All of Us Research Program. NHCOA facilitates the education and engagement of Hispanic older adults, their families, and caregivers. Next slide, please. Although precision medicine is relatively new, the concept has been a part of healthcare for many years. For example, a person who needs a blood transfusion is not given blood from a randomly selected donor. Instead, the donor's blood type is matched to the recipient to reduce the risk of complications. Other examples of precision medicine can be found in several areas. Think of prescription glasses, hearing aids, and insulin pumps. However, the role of precision medicine in day-to-day healthcare is limited. Researchers hope that this approach will expand many areas of health and healthcare in the coming years. Next slide. Traditional medicine works on a one-size-fits-all approach. In this method, disease treatment and prevention strategies are developed for an average person. Generally, it's based on who participates in research, with less consideration for differences between people. Precision medicine acknowledges that every person is unique. Our habits, our environments, our biology, and the interaction of these factors generally impacts our health. These unique variables also mean that a medical treatment that works for one person might not work for the next person. Rather than using a cookie-cutter one-size-fits-all approach, precision medicine aims to deliver the right treatment for the right person at the right time to keep people healthier longer. Ultimately, precision medicine may produce more accurate diagnoses, earlier detection, and better preventive strategies and treatment choices. Precision medicine is a radical shift in how each of us can receive the best care possible based on our unique makeup. Next slide. And that is where the All of Us Research Program comes in. Next slide. The All of Us Research Program is an effort to bring together 1 million or more participants who reflect the diversity of people living in the United States who will volunteer their health data over a decade or longer. The program is open to people both healthy and sick from all communities. Unlike a single research study focused on a specific disease or population, All of Us serves as a national research resource to inform thousands of studies covering a wide variety of health conditions. All of Us is led by the National Institutes of Health and is the cornerstone of the Precision Medicine Initiative that was launched in January 2015 with the goal of moving forward the promises of precision medicine. A set of core values are central to this program and guide the program's commitment to doing things differently. The core values are: participation is open to all, participants reflect the rich diversity of the United States, participants are partners in the research, trust will be earned through transparency, participants have access to their information, data will be accessed broadly for research purposes, security and privacy are of the highest importance, and the program is a catalyst for positive change in research. Next slide. The mission of the All of Us Research Program is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for everyone. There are three primary objectives to achieve this bold mission: build and nurture trusted relationships with participants, deliver a valuable, rich resource of data, which will be accessible in new ways, and catalyze a robust ecosystem of researchers who want to use the data. Next slide. So why is this program necessary? Well, at every level, you can see that there are needs for this program. For instance, many people and populations have been left out of biomedical research and thus often left out of healthcare solutions. Precision medicine is still in the early days, so providers do not have enough information available to provide precision care for many conditions. And researchers spend a lot of time and resources creating new IT systems, databases, and analytical tools. A single lab's resources may not be sufficient to answer the research questions that matter. Next slide. So how does all of us work? Participants share their data. Researchers then study the data. Participants get the information back to them. And then researchers share their discoveries. Next slide. The All of Us program collects a wide variety of data, including environmental, social, biological, clinical, and behavioral. Next slide. The program has 4 value statements that are developed with community input. The value of participating in All of Us will resonate differently for each individual and community. The 4 value statements include an opportunity to learn some of your own health indicators and get your own data, an opportunity to fight disease and improve the health of future generations, the opportunity to ensure that your community is included in studies that may lead to new understandings and treatments, and the opportunity to be a part of a movement to make our healthcare more precise, more personal, and more effective. Next slide. The All of Us research program's most important responsibility is to safeguard a person's or a participant's identity and data. And the program is using the highest standards of privacy and data security to protect this data and information. The program knows that participants want to understand what data will be collected and how it will be returned to them, and they absolutely want assurances that their data is being protected. From the beginning, the program has implemented privacy and security principles to help ensure participant data is as safe as it can be. Other precautionary steps are being taken, such as end-to-end encryption, penetration tests, and all things to figure out if there are any vulnerabilities in the system. Next slide. Some of the selected scientific opportunities include, for researchers, the ability to develop quantitative estimates of risk for a range of diseases by integrating environmental exposure and genetic factors, developing solutions to health disparities, empowering study participants with data and information to improve their health, and creating a platform to enable trials of targeted therapies. Next slide. The future of health begins with you. Next slide. To learn more or answer any additional questions you have about the program, we urge you to visit the program site at joinallofus.org. You can also follow the program on social media at #joinallofus. Okay. Next, hear from Dr. Olveen Carrasquillo, a professor of medicine and public health sciences at the University of Miami's Miller School of Medicine. For the last 10 years, Dr. Carrasquillo has been the chief of the Division of General Internal Medicine. He oversees a clinical, teaching, and research enterprise of 51 full-time faculty, including 6 primary care practices and an additional ambulatory hospital-based clinic at Jackson Health System. Dr. Carrasquillo is a national expert in minority health, health disparities, community-based participatory research, access to care, and community health worker interventions. Today, Dr. Carrasquillo will discuss his research and research related to COVID-19. Thank you and welcome, Dr. Carrasquillo.
Thank you, and it's a pleasure to be here. And again, I apologize. There's a little bit of miscommunication. I was going to talk about All of Us, which is the research I've been really involved with for the last few years. That's what I was asked to talk. That's what they were expecting me to talk about, but I misunderstood that it was about COVID research that we're doing now. So I'll be glad to take any questions about All of Us as well. But what I'll be talking about, it's a little bit about just the COVID research that's been going on, since that was the theme of today's conference call, and some of the reasons why we really need to be supportive of our research agenda, and why all this is really important, especially now in the, what's going on right now. So if we could have the next slide. I'll talk a little bit about the data that you know about, but really what 3 months of research have taught us about COVID and why it's really important to continue to support this kind of research enterprise and research that's going on. Next slide. So one of the things that's obviously epidemiologic surveillance research, which is really critical. And these are the numbers as of updated as of this morning. But of course, we wouldn't have these numbers without good epidemiologic research. And it's fascinating, especially how, the worldwide numbers are counted and how they're different from country to country, but that we're able to get these numbers that show us the scope of the epidemic and how big it's been, both in countries like Spain, that really, if you look by the population size, it's probably the hardest hit country in terms of cases. But we also see that the United States have really high cases per 100,000, with places like New York much more disproportionately affected. Here in Florida, we have obviously a lot of cases and almost 1,000 deaths, but it pales in comparison to New York, which is actually a state with a smaller population than Florida. But this is the kind of stuff that research is really important for. Next slide. The picture of the COVID virus that we all know very famously, I mean, that's all basically science research, basic science research about, using high-powered microscopes that can actually see the virus and can tell us what it really looks like. And these spikes, the reason we call them coronaviruses, all that is from obviously advances in imaging and other types of research that allow to actually see these viruses. Next slide. So research has told us not only about these spikes, this is some of the slides we use for the students. It's a beta coronavirus. It's the same type of SARS, but we actually know the sequence for the virus was actually done within a few weeks of the outbreak. And so we know everything about it. We know a lot about the proteins, where it binds, and the different things that this virus has been extremely novel at, ways to penetrate cells and replicate itself. And we know all about these viruses through research. Next slide. There's a lot of different types of coronaviruses. Obviously, SARS and MERS were some of the ones. But the fact that, this is all many, many years of virology research into the coronaviruses. So when we had COVID come out, we already had a lot to build on in terms of basic science research about these viruses. Next slide. A lot of the stuff that we know about the epidemiology, the things didn't pop up. Just hit next, and you'll see yeah. Yep, good. Okay, we still know the differences about SARS, how it had a higher mortality rate, and even MERS, and that COVID-19 actually has a much lower mortality rate, but it's higher than influenza, although some studies coming out in the last day or two suggest it may be even lower than this, because a lot of more people were asymptomatic when we thought about. But again, all importance of epidemiologic research and mapping out these epidemics. Next slide. Now based on good clinical research, data from China and other countries, we know the spectrum of the disease. 80% are mild, 15% severe, and 5% critical that need to be on ventilators and intubated. And this all comes, again, from medical research that we've just done in the last 3 months. Next slide. And these are the classifications. We actually know, you don't have to know any of these numbers. These are medical numbers, but we have very good criteria about how to classify into mild, severe, or critical disease, and what are the criteria for each of these and how patients fall in. Again, emphasizing clinical observational research, and that's how we know that 80% of the cases are either mild or no symptoms. Next slide. This is data from Florida, and you will see, since this is an aging thing, If you look at the cases, you see that the cases are distributed among all age groups. So all young people are very vulnerable to having this disease, despite what was thought about it. But then when you look at hospitalization and deaths, you do see that those are mostly concentrated in the elderly, and those are really the high risk groups. Once you get age, over 70, you're going to see mortality rates that are really approaching about 1/3 of the population affected. And again, this is from Florida, but we're seeing this all in other places. Next slide. We also know the disparities in COVID. This is African Americans, but we're seeing data from some other states as well, showing that minorities are overrepresented for a lot of the reasons we know about social determinants of health are overrepresented in the number of people that have died from the epidemic, which is very troubling when it comes to, again, when these big crises happen, they seem to affect the most vulnerable in our society, the elderly, minorities. Next slide. We've also done a lot of research about the transmission and ongoing research about how long the virus lasts, but we've done some of this already, showing, that it can live on average, on stainless steel, maybe about 6 hours, but some studies suggest that it can stay on surfaces for up to 3 days if not properly cleaned, and that a lot of the spread is not so much from the aerosolized, but actually the contact with surfaces. So both are very important. So that's why people not only wear masks, but also recommend using gloves because it can be in a lot of surfaces. Next slide. We also know how to treat them a lot more than we used to know, how to manage the oxygen status, that basically laying on your stomach is better for ventilating these patients than the standard approach where we have them lay on their back. So we have a lot of evolving treatments that have been done because of medical research in this. Next slide. Next slide. And how infectious it is, again, coming from research, but each person on average with COVID can infect up to 1.5 to 2.5 people. So it's much less infectious than things like measles, and about the same infectious rate as influenza. The problem is that it seems to have a much higher mortality rate. Next slide. Next slide. Sorry, go ahead. I'm just conscious of time. So basically, what has medical research taught us in 3 months? We know a lot about the virus, its structure, and why it's so deadly. We know a lot about how it's spread, whom it affects, which groups have high death rates. And we also know a lot about the clinical course and how to provide care. So just in 3 months, this is the type of research that's critical, that's been advancing a lot. And it's really amazing how much we learned in 3 months because we already had a good scientific background. Next slide. However, we don't know a lot. We don't know how widespread the virus is in the community. We don't know about effective treatments. Does it go away in the summer? How protective are antibodies, and can people get it again, and how soon? Everyone's asking me, when is it going to go away? When will things run to normal? And when will the vaccine be ready? So these are a lot of unknown factors. Well, we know a lot. Next slide. Also been a lot of myths and lies out there, which is what raises research important. You've all raised these things up in some of the recent protests. People have said there's no such thing as COVID. It's a media hype. I saw some protesters saying how they think Nancy Pelosi created the virus to discredit Trump. I see people saying, I don't need to get a test. I know I don't have it, even though we know a lot about it being asymptomatic. Some people have said social isolation is a disproven scientific theory. People think the 5G towers. Even our federal government, some of our federal leaders, you've heard them say about the whole COVID thing will go away in a few weeks. That was in February. It'll go away in the summer. And people postulating that there's an effective treatment when there is no proven treatment. So it's a time where we really need to know about the importance of research, and we have even many of our leaders spreading a lot of the myths and lies about the virus. Next slide. So the anti-malarial is one great story about how science was misused. There's some studies in the lab that these medicines may work against certain types of coronaviruses. In China, uncontrolled studies and no real good comparison group suggested maybe some people with these medications may be better, but again, not well done studies. And then there was a poorly done study in France with a very, very small number of people that was very controversial, suggested it may work, but obviously even they said you need a large study to see if these findings are true. And now it turns out some recent research has refuted the original findings, but what we need are large, well done randomized studies, and people that don't really understand science really got this story wrong because we don't know if the treatment works or not. Next slide. Almost done. So this is some of the studies we're doing here at the University of Miami, but every major academic health center is doing these type of studies. This test is basically getting a population surveillance. We're using what are called the antibodies. So it's not the COVID test that tells whether you had COVID or not. This is a study that says if you've had it in the past months. And so we're doing a randomly selecting population using electric information from the power and light company. They're being called and asked to volunteer, and then we have stations set up to show whether people are positive or not for prior infection. It doesn't tell them, but that'll tell us how the curve of the infection is changing and whether social distancing worked or not. We also did a smaller study in Fisher Island, which is a very wealthy population, but they requested that this test be done using the antibodies. So not whether they have COVID, but basically whether the social isolation in that island of 2,000 worked or not. And some of the data suggested that, yes, social isolation measures were effective in doing this in a population of 2,000 residents. So the kind of research that's really important. Next slide. We're also doing something, the HERO study. This is one of the ones which my All of Us team is not going to help us with. But basically, it shows about whether anti-malarial drugs, if you give them to health workers that are not infected, will help them from preventing COVID. Next slide. The study, again, you don't have to know a lot of this, but this is what I mean by well-done scientific research. It has primary, secondary, exploratory objectives, well-designed. The study is going to be 15,000 healthcare workers, so a big study, which is what we need across 40 different sites. So you see how it works in different sites. But it's a type of studies that are really, really important right now to know whether these drugs, you know, people say they work, but we don't know, and whether they work to prevent the infection. Next slide. I'm almost done. We have a lot of different, again, almost all major universities have a lot of research going on. You know, working on a testing platform, whether plasma serum from people that had the infection actually works or not, trying to develop a vaccine, whether things that dilate your pulmonary, your bronchioles like nitrous oxide work, and even studies about stem cells and whether stem cells can be used to treat the inflammation. So these are all examples of COVID research that are going on nationally that are very important. Here at the University of Miami, we did have to halt the All of Us study, but I still want to plug it. Join allofus.org. Once things resume, we're hopeful that by June we'll start enrolling again, but we don't know yet. We're waiting for guidance on that. But obviously we don't want to bring people in during this outbreak. But very important research going on, whether it's COVID or whether it's a major genetic study like All of Us that you heard. Next slide. I think there's the last one. So I think now research is more important than ever for COVID, but all nationally. I think COVID just makes the importance of how important it was that we had a leg up all the basic science research we already knew about coronaviruses. We need to continue developing a genetics research infrastructure that was critical here as well. The one thing it showed was how poorly we've done in our public health research infrastructure and how poorly developed it has been and how we really need to reinvest in it. And we also need systems to fund studies like the HERO study to carry out large clinical research very quickly so that we have timely data. And I think from as an educator, you know, it clearly shows the lack of scientific competency in our nation, including our leaders, and how they really don't understand and get science. And this whole thing about my gut is more important than what my scientists tell us. You know, it's really concerning for our nation. We really need to invest in our STEM programs, K through 12, as well as post-secondary education. But it clearly shows a glaring lack of scientific competency in our nation that's really concerning to many of us. And I think that's it. I'll open it up for questions if there's any, and then I do have to go back to my telemedicine visits with my patients today. Thank you very much for being able to present this.
Thank you so much, Dr. Carrasquillo. Right now, the only question that I see is people want to know if the slides will be made available after the presentation, and I believe that that is definitely possible. I know we have quite a few time constraints, so if there are questions, we will address them at the end, and then maybe if a panelist has to drop off, we can send those via email and then send them out. Sure. So thank you.
Thank you. It was my pleasure being with you, and thank you for this opportunity. Take care.
Thank you.
Okay,
so we will continue with our second panel. Our next group of speakers will be providing additional information about COVID-19, including the relation and impact between COVID-19 and chronic illness, caring for your mental health during this pandemic, and helpful resources available for caregivers. People 60 years of age and older and those with underlying health conditions such as diabetes, heart disease, and lung disease are most vulnerable to getting sick and even dying from COVID-19. On March 9, 2020, the director of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention said that older adults should take extra precautions to protect themselves. Early data suggests older adults are twice as likely to have serious illness if infected with COVID-19. This may be due to the fact that as people age, their immune systems change, making it harder for their body to fight off diseases and infection. Many older adults are more likely to have underlying health conditions that make it harder to cope with and recover from illnesses. Our next speaker, Dr. Michael Yabara, is a board-certified emergency physician and vice president of medical affairs and strategic alliances at Pharma. In his capacity at Pharma, Dr. Yabara leads stakeholder outreach on federal health policy issues. In addition to his work at Pharma, he works clinically in the emergency department at MedStar Georgetown University Hospital. Today, Dr. Yabara will speak about coronavirus and chronic illnesses. Thank you.
Yeah, thank you. Thanks for having me. Pleased to be here. Appreciate the invitation from Dr. Cruz and Christina and Natalie for organizing this. And to be able to talk about our industry's commitment to beating COVID-19, as well as the impact that it's having on individuals with chronic diseases. As was mentioned, I'm an emergency physician by training, working clinically here in DC, one of the local emergency departments. So that experience of seeing patients in this time is really, shaping my thinking on all of this clearly. And then also I get to work in an industry that is literally spending 24 hours a day, 7 days a week, trying to find treatments, therapeutics, vaccines to bring to patients as soon as possible and as soon as safe. But today I'm coming to you from my spare bedroom of my house in Bethesda, Maryland, just outside of the city. When I work clinically, when I'm in the emergency department, my next shift is tomorrow night, I'm really am struck by the high prevalence of chronic disease in individuals that are impacted by this virus. While the spread of the virus is potentially being kind of exacerbated by younger and healthier individuals, too many elder individuals and people that have comorbid conditions like hypertension, diabetes, cardiovascular disease, immune diseases, are showing signs of serious illness, and those are the patients that are often getting admitted. Clearly, the virus can impact anyone, but we are concerned about the data that's showing the impact on people that have these underlying health conditions, again, like diabetes, chronic lung disease, cardiovascular disease, immune diseases like HIV, and appear to lead to more serious complications from COVID-19. So it's really important for these individuals to be prepared, to think through the implications of this virus on their daily life, and do things like get extra supplies of necessary medications, make sure that their testing is able to be accomplished in a safe setting, make sure that they have appropriate supplies of oxygen should they need it, or other durable medical equipment. And then also, one of the things that's really been striking to me as a physician is how quickly we have adopted telemedicine. I guess my own observation is that we probably were behind the times when it came to telemedicine before coronavirus, and COVID-19 has really forced the healthcare system to rapidly adopt telemedicine. And that, if there are some positive things that come out of this, that change is something that likely will stay once the coronavirus is passed, because we are able to provide good care via telemedicine. And so if you have a chronic illness, it's important to still check in with your healthcare provider. And thankfully, a number of healthcare providers are able to do that via e-visits or other telemedicines. And then also it's important to just be prepared with over-the-counter medicines as well. And things are really changing hourly when it comes to the status and learnings of COVID-19. And the member companies, the biopharmaceutical companies that I'm lucky enough to work with on a daily basis before I go to the ER at night, are learning about potential medicines and vaccines. And I want to just give a quick sample and overview of the industry's work and specific response to date. So again, the biopharma industry is working around the clock to attack COVID-19. There's a tremendous amount of collaborative efforts that's occurring between biopharma companies as well as research scientists around the world. We heard from one just a few minutes ago, as well as federal agencies like the NIH and the CDC. But these efforts are all about, bringing treatments and bringing therapeutics to market as quickly and as safely as possible. So one of the things that struck me early on in this crisis was the issue around testing. And as an emergency physician, when I first started caring for patients that I suspected of having coronavirus, the initial testing results were taking a significant amount of time to come back. And each shift that I worked, I noticed that the time was going down, but it wasn't, there were still delays with that first batch of testing that I ordered. And, I just want to highlight the fact that even though the companies that we work with at pharma are focused on medicine, they also have tremendous laboratory capabilities. So a number of biopharma companies are working in conjunction with life science companies to develop new diagnostics to test for the virus. So Eli Lilly, one of our members, announced in early April, late March, that there was a major testing initiative in Indiana where they used their specialized research laboratory to analyze samples taken from Indiana healthcare facilities, nursing homes, emergency rooms. And they did this to help the backlog in Indiana. They didn't accept any money from government agencies, from hospitals, insurance companies, or patients. It was a contribution that they made that really helped the testing situation. And it's a really positive example. And we're seeing great activity like that from biopharma companies around the country and the world. Second, biopharma is screening their vast global libraries of medicines to identify potential treatments and making those medicines available to patients through clinical trials and compassionate use. There's been some really great articles. Our last speaker just highlighted some of them, but to give you a flavor of some of the research that biopharma companies are doing right now, it's really a combination of antiviral treatments, antibody treatments, and then vaccines. So in the antiviral category, folks have heard about a medicine called remdesivir, which is currently in phase 3 clinical trials. There are a number of clinical trials going on across the US. It was originally a medicine invented to treat Ebola, but it actually now is showing good test tube response to coronavirus, and so it's being studied in humans, and we're anxiously awaiting the results of that treatment. There are also a number of chronic disease medicines that are being studied as potential treatments. There are pathways that are being looked at from conditions like rheumatoid arthritis and the inflammatory pathways, and whether we can use some of those medicines to treat patients with COVID-19. More work needs to be done, but those trials are underway, and we're hopeful that results will start coming in the coming weeks. Third, we are looking at this new technology that would use antibodies that are synthesized outside of the body that could be helpful for high-risk populations, like individuals that have chronic diseases or in nursing homes, or also potentially for healthcare providers. And there's been a lot of attention paid to this therapeutic modality. And then fourth, the thing that I think most people are very focused on and we're all anxious for is a vaccine. And a vaccine is important because it provides the herd immunity that is needed to suppress the virus from being an epidemic. And so, there's a lot being written and said about vaccines, but I just want to highlight a couple of things. Number one, there is a phase 1 clinical trial going on right now of a vaccine that's been invented and manufactured by Moderna, a company in Boston, and then another biopharma company. A number of them are investigating, but there are a few lead candidates out there. We don't know which one's going to work, but we're hopeful. We need as many shots on goal as possible. So Johnson & Johnson, for example, announced that they have a lead candidate, and that is hoping to enter clinical trials in the coming months. And before we even know if the vaccine works or not, they've already committed to producing hundreds of millions, if not up to 1 billion doses by 2021. So it's a tremendous effort. It's a tremendous commitment. And given the importance of it, it is so needed. And I'm really confident in the industry and their ability to achieve the goal of beating the virus. So thank you for having me. I really appreciate the opportunity to talk about all the work that's happening, the impact that the virus is having on patients with chronic disease. And thanks. I look forward to the rest of the discussion.
Thank you so much, Dr. Ybarra. If anyone has questions, please use the question and answer box at the bottom, and then we will address those during the question and answer session. The next topic is caring for mental health amid this pandemic. The outbreak of coronavirus disease or COVID-19 may be stressful for people. It is natural to feel stress, anxiety, grief, and worry during and after a disaster, or in this case, a pandemic. Everyone reacts differently, and your own feelings will change over time. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you, the people you care about, and your community stronger. Our next speaker is Dr. Octavio Martinez. Dr. Martinez is the Executive Director of the Hogg Foundation for Mental Health and Senior Associate Vice President within the Division of Diversity and Community Engagement at the University of Texas in Austin. Additionally, he is a professor of psychiatry at the Dell Medical School and clinical professor at the Steve Hicks School of Social Work. Today, Dr. Martinez will speak about the importance of caring for your mental health during COVID-19. Thank you and welcome, Dr. Martinez.
Thank you, Christina. And the slides can be brought up. While we're waiting for the slides, I'd like to say thank you for everyone for participating today and coming together, and especially NHCOA to be able to bring us together to address these important topics that have already been highlighted and that we will continue during the rest of our presentation. Next slide, please. So one of the things I'd like to do is contextualize. You heard a lot about science, which is extremely important and which we really need to adhere to. But I'd like to also contextualize that what's happening with COVID-19, it's really like an unmasker, a revealer. It is showing our gaps, our challenges, where we have disinvested, and also where we have invested, where we need to do more. And I'd like to highlight that there has been an ongoing effort here in the United States called to create an age-friendly health system. NHCOA has been part of that, so has the Hartford Foundation, as well as Trust for America's Health. And as you can see here in this slide, the aim is to, in fact, to improve the care of older adults everywhere where they receive care. It doesn't matter if it's in a hospital setting, an ambulatory setting, or at the kitchen table, which is at home. We really want to and have been working on that. I think it's extremely important to realize these are efforts that started before COVID-19 and now really highlight how important it is, especially when we're dealing with a crisis of this magnitude. As you can see there, the three main principles are to adhere to evidence-based practice, which you have heard about already from our previous presenters, reducing harm through reliable implementation across all those different settings that I've mentioned, and we want the delivered care to be consistent with the goals and the preferences of our older adults. Next slide, please. Getting to what NHCOA has been working on, in full disclosure, I'm in the board of NHCOA and have been a former chair of the board for NHCOA. So working with, on behalf and for Latinos elders and Hispano elders is extremely important to me. And so one of the things that we've also been working on in NHCOA especially is enhancing Latinx elder mental health and health, because there is no health without mental health. The mind and body are truly tied together. But our vision is to, in fact, to create there, as you can see in the first bullet, a seamless integrated health, mental health, substance use care delivered in a culturally, linguistically, person-centered framework. At the individual, the family, the community, practice, the system, and the workforce level. It has to be multifactorial. The key point must be but one of the key points that we need to keep in mind is how heterogeneous we are. We are not just one uniform group when it comes to Latinos or Hispanos. The Latinx community is very heterogeneous. And so we must not oversimplify the values, the customs, or the beliefs of any one individual or any one group. We also, though, have to keep in context within the fact that here in the United States, we do have a dominant society. And we also have been experienced historically, and even still to this day, what's called othering, which is that the dominant society has a tendency to understand non-dominant groups as inferior, exotic, or deviant. So we must be cautious and be vigilant of that. As you can see of some of the numbers that are being shared in reference to what's been happening to Hispanics, Latinos, as well as our African American populations and other cultures and groups of color. It's key that we all be very humble, and we have what we call practice cultural humility. In other words, we should have an open mind and recognize that each of us, everyone that here is listening to me, and including us as the panelists, we each have and see the world through our own very distinctive cultural lens. and recognizing each other's humanity. Next slide, please. Now, this is a very busy slide, and actually it's already been talked about, but I do want to enhance and point out that it's also very relevant when it comes to our behavioral health, mental health, and our substance use issues that are affecting all of us, but especially those that are dealing with COVID-19 and also the elder population, which is that COVID-19 is exploiting our existing health disparities and the healthcare system inequities. This slide, and thank goodness we'll share it with all of you, then you can actually take a look at it and see those little tiny numbers. But it comes out of Chicago, and it really, what it does, it highlights that in Chicago, the African-American community is being hit very hard, but one of the hardest hits, and everything has even larger percentage numbers of impact of the COVID-19 as it is infecting those, is actually the Latino population in Chicago. And we're unfortunately seeing this in New York, in Miami, and other major cities around the United States. Next slide. So the impact on our elder mental health, family members, and caregivers. None of us really live alone or outside of our culture or our society. And in fact, this is impacting across the board. And according to the CDC, this is extremely important, has already been laid out with the statistics that have been shared earlier. But by golly, this is just really devastating our elder community. 8 out of 10 deaths reported in the United States of America have been adults 65 years or older. So this is really hitting hard. The infections rates is one thing, but the mortality, the death rates are really quite striking. And so it is not uncommon, and it's actually a normal response for all of us to have anxiety, grief over our loss of a loved one, but also grief of the change to our lives. It is affecting all of us. And so fear is also a very normal response. But what we do with that fear, how we let it impact us, how we let the anxiety and the grief dictate our actions, actually is what we still have something we can do with and have control of. And we need to reach out and ensure that we're actually looking for support and help that can actually help us go through the anxiety, grief, and the fears that we're all experiencing. Because if we do not, there will be dire consequences. One thing we need to keep in mind is right now we're in the midst of this crisis, but as they keep talking about this curve, guess what? There's another side of the curve, the downside, where hopefully we do have interventions, we do get to a vaccine, but that doesn't mean that the trauma that has been inflicted upon all of us, everything from morbidity, mortality, is going to go away. We'll be dealing with these issues for years to come. And so though practice spatial distancing is extremely important, we need to remember that's about spatial distancing. That's about distance between us, the right things to do, but we shouldn't socially disconnect from each other. Now, here's the thing, getting back to, what happened before COVID-19, we already had issues of isolation, and we already had issues of loneliness with our elders. And we were addressing those and coming up with interventions and protocols to hopefully address that. COVID-19 is just making things worse. So we really need to be cognizant and recognize that and avoid isolating our elders, and also don't contribute to loneliness. And there's things we can do. We can use old and new technology. Let us not forget picking up a little landline or just a telephone to call a loved one, a neighbor, an elder, can have a lot of impact. New technology. Don't forget about all the social media that's out there that can be utilized. Everything from smartphones to what we're doing here, right? Where we're utilizing Zoom technology. Now, it may be you need to help your elder to help set those things up or to provide those resources so it can happen, but we can do that together and as a society. And we need to be creative to stay connected in this day and age during this crisis. So think intergenerationally. Think about, when before COVID-19 and a happy birthday card that say was made by your grandchild. What a wonderful impact it had. Granted, buying a birthday card, from the store is beautiful, but one made by one's child or even by another adult just has so much that it can really provide. We can still do that. Snail mail, that's old technology. You can mail a card, you can mail something you've made to an elder or to a loved one. And of course, I think it's extremely important that we not forget that many of us have faith and we're connected to our faith communities. And in this day and age, and especially for elderly, that's being impacted. So we should be creative. Talk to your pastor, your minister, the rabbi, Nuestro Padre, and to talk to them. How can we stay connected? Let's do it through Zoom. Let's set that up. Do we do it through a telephone call? Maybe it's through radio, television. There's so many ways that we can still stay connected. Next slide, please. And one of the other things, and it was mentioned already, is developing a care plan. Now, developing a care plan, what it does, it really does impact our mental health because it gives us the sense of mind that we're doing something beneficial for ourselves and for our loved ones. But also, it does provide some peace that we have a plan regardless of what happens. So knowing what the health conditions are of the elder, the medications, who are the providers, the emergency contacts, end-of-life care preferences, so important that those be respected. Stock up on what we need to be able to get through this crisis. And our elders need our help more than ever because they are more susceptible to, one, the infection, because unfortunately, as we age, we have a tendency to pick up chronic illnesses along the way. And of course, as you've seen the statistics, it also means that we're at greater risk of mortality. So over-the-counter medications, food, beverages, pet supplies, we shouldn't forget of our pets, especially elders who, as they age, they have, unfortunately, life has a tendency to take away some of our loved ones and our friends, but we might still have our pets with us, be a pet, a dog, a fish. It doesn't matter. It's a connection to our humanity and to the world around us and what we really care about. Communication is so key and so important. I think it's one of the things that we're all talking about here and have been outlaid how important that really is. But when it comes to our elders, and it's always been the case, but even more so now, to be respectful to our elders and to be culturally, linguistically person-centered, it is so key, especially for the Latino community and the Hispanic community. We must also ensure that we're making the information, and when we're sharing information or you're talking to a loved one, be it a son or a daughter talking to their father or mother, or you're talking to their abuelita or abuelito, make it easy to understand, but don't be condescending. These are folks that have lived a very long and fruitful life and have a lot of wisdom they can share with us, and they deserve our respect. Next slide, please. And so overall, we should be supporting our elder well-being. Keep in mind, though, that even though it is important to stay connected and to be informed and getting it from sites that are reputable, it is also has a flip side to it, which is too much news and media can, in fact, have a negative impact. So an elder sitting in front of the news and just absorbing the news all day long is not a positive thing. We need to stay connected, and this is true actually for all of us. We shouldn't let news dictate it because it can, in fact, undermine our mental health and start us to feel that we have really going down a dark place. And given that, though, there are things that we can do, things that we should be filling our life with. And these are so important, have always been, but even more so now. And as you can see there, including any kind of physical exercise. Caveat, though, is that, of course, that it is not contraindicated due to any medical condition an elder may be dealing with. But be able to stretch, to yoga, Tai Chi, any other type of taking a nice walk around the house or the apartment complex, adhering to the guidelines, though, of staying our spatial distancing at least 6 feet, wearing a mask, all of those kind of things, but staying physically active. Or, we know we can also do exercise when we're sitting in a chair, be it a wheelchair or any other type. So there are many ways that we can stay still physically active. And physical activity is good for the mind and good for our mental health. Also, just staying mentally engaged. There's everything we can do. I have chess there. Chess can be played with, no longer maybe one-on-one, but we can do it either through, a telephone, and you can do your moves, or you can do it through Zoom. There's, like I said, be creative of how you stay connected, but also reading, music, art projects, and of course, relaxation exercises such as meditation, deep breathing, and guided imagery that have been shown to be extremely beneficial, even if we only do them for a few minutes a day. What the impact that it has on that, on our health is just amazing and beneficial, and we should keep that in mind. And we should be talking with our elders about these very activities and options, and see what are their sort of choices and things that they prefer that they would like to make. But keeping engaged is going to be so critical. So please avoid isolation, and definitely don't leave anyone to feel like they're lonely. And like I said, though we're talking about our elders here, because National Hispanic Council on Aging, this in fact can affect all of us. Affect all of us, be it a child, a youth, an adult, a grown-up, as well as our elders. I think that's my last slide. Is that correct, Christina? Yes, thank you.
Perfect. Thank you so much, Dr. Martinez. With already more than 40 million family caregivers helping loved ones care in the United States, it's expected that COVID-19 will increase the number of family caregivers who are providing short-term or long-term care to older loved ones. It's important to highlight that family caregivers are essential to the health and care of older adults. Our next speaker is Yvette Pena, an accomplished award-winning marketer with over 20 years of experience specializing in multicultural initiatives. In 2016, AARP named her Vice President of Strategies for the Hispanic and Latino audience in the United States and Puerto Rico. Yvette has also championed innovation by leveraging digital, social, and mobile platforms to drive engagements with Latinos ages 50 and over. Let's learn more about AARP's resources and guidance for family caregivers, specifically how to create a plan for those that are caring for someone who is at higher risk of serious illness if infected with COVID-19, and how to support those new to caregiving during this pandemic. Welcome, Yvette.
Gracias. Can you cue up my slides, please? Can you all hear me?
Yes, we can hear you.
Wonderful. Great. Hola, everyone. I hope you and your loved ones are well, safe, and very healthy. I'm Yvette Peña, Vice President of Multicultural Leadership at AARP, and I lead the Latino Audience Strategy. Gracias to Dr. Cruz and the NHCOA team for inviting me to participate today. As an Afro-Latina, I am so proud to work at AARP, an organization that has a powerful voice in promoting the well-being of our multicultural communities. I will share what AARP is doing to help support our family caregivers during this COVID-19 pandemic. At AARP, we've been working tirelessly. I'm sure you've seen our ads, seen us on the internet, and we're working directly with government and state officials to make sure that you and the loved ones that are with you are taken care of with the needed resources that we make available. As I'm sure you can all feel it, this is a very stressful time for all of us, and even more so for Latino communities across the country. Hispanics are among the nation's leading populations living in multi-generational family households, making them amongst the most impacted by COVID-19. Many in our community are unable to isolate at home due to the nature of their jobs, putting themselves, their children, and primarily their older relatives at risk, all within the same household. At AARP, we see this struggle in our community and among ourselves, and it's why we put such a strong focus on allocating resources to aid family caregivers during this challenging time. Can you switch to page 2, please? I'm sure that I share the same sentiment with you, that each of us needs to check in with our relatives during this time, and Dr. Martinez stressed this. You know, this is a time to rely on each other, not just for physical support, but also for that emotional and mental support. And this ties heavily into our focus on caregiving during this pandemic. Many of us are aware, according to the CDC, that older adults are at higher risk for developing serious illness from the virus. With more than 40 million caregivers, yes, that is correct, 40 million, that are already helping loved ones in the US, we know that this virus will be affecting mothers, fathers, our abuelitos, amistades across the nation, and this will lead to more responsibility for those existing caregivers, and it will also create a whole new set of caregivers. Can you switch to slide 3, please? As caregivers, whether experienced or new to this role, we can stay prepared and plan ahead. We may not always identify as a caregiver, but if you are helping a family member, a neighbor with an everyday task, then you are a caregiver and you are carrying out these duties. There are 5 main steps that you can take to provide care to your loved ones and to have peace of mind along the way. Dr. Martinez went through some of them, so I'll go through them quickly, and on the screen, you should see a quick list. The first, as Dr. Martinez also mentioned, is to pull together a team. It is so important to have a list of individuals in your family, friends, neighbors that can be your allies during this time to source the key services that you need and that your community can provide. Second is to take an inventory of all the essential items. you should calculate how much food, medication, and basic supplies the person that you're caring for would need. You know, having a 2-week supply, for example, of water, cleaning products, medical supplies. Third, getting all the medications in order to ask and also ask for extra. It's so important to ensure that you have a list of these medications, that you have medical contacts and any health-related information handy. We recommend having at least a 30-day supply of essential medications on hand. Fourth step is to create a plan to stay connected. You know, for example, if your loved one lives away from you or in a nursing home, we encourage you to set up communication lines via the internet with a FaceTime video with a nieto, a Skype with a primo, or WhatsApp with your familia, or a simple call or a text. The key thing is to just stay connected. And the final step is to maintain personal safety and self-care. Taking care of your loved ones begins with taking care of yourself. If you are not well, you can't take care of anyone else. So right now, it's crucial that you limit contact with visitors, that you stay home as much as possible, but to exercise, as Dr. Martinez said, make sure that your body is healthy, and of course, continue to follow the CDC guidelines. Can you please switch to slide 4? And you know, these 5 steps could really help you stay ahead of the game as a caretaker. Having a care recipient in a nursing home is another big subject that I like to touch upon. My heart goes out to all those who are away from a loved one right now, especially if a loved one is in special care. If this is the case for you, I encourage you to stay in very close contact with the nursing home. At AARP, we've developed a few key questions that you can ask to ensure the safety of your loved one. We recommend this question: has anyone in the nursing home tested positive for COVID-19? Transparency is important and can save a life. This includes residents of a nursing home, staff, visiting vendors. Second question is, what is the nursing home doing to prevent infections? It's important to understand how the nursing home staff is being screened for the virus, especially as they come and go from their homes. A third question is, does the nursing home staff have and are they trained to use personal protective equipment, PPE, like masks, face shields, that they need to keep themselves safe as well as the patients? Fourth question, is the nursing home what are they doing to help the residents stay connected to their families and loved ones during this time? Are they helping residents by making a call or a video? Is there a set schedule? These things are important for you to have peace of mind and ensure that your loved one is okay. The fifth question is there a plan for the nursing home to communicate with the families on a regular basis? So it's important that there is some kind of regular basis communication. And lastly, we're asking, is a nursing home currently at full staffing levels for nurses, aides, and other workers? It's important to understand this, because if the home has a staffing shortage, what is the plan to make sure that the needs of the residents are met? So depending on the answers that you receive to these questions, you may want to ask yourself whether you should take your loved one out of a nursing home during this time. But the reality is that there is no one-size-fits-all answer, whether someone should stay in a nursing home or move into the home of a family carer family person who cares. But there are a few things that this is dependent on. Number one, the condition of the individual and the type of care that they need, the level of support that the family can provide, and how the facility is handling the virus. Before considering this move, we highly recommend that the families consult with the loved one's medical providers for expert advice. A few things to keep in mind if you're considering a move. Some care facilities may offer medical services beyond what can be provided at home. It is also important to note that eligibility for Medicaid and care may change if the individual is removed from a nursing home. The rules vary from state to state, and some individuals may no longer qualify for Medicaid or even be permitted to return to the nursing home in the future. So please, for each of the challenges, it's best to remove your loved ones from a nursing home. I also want all of you to know that AARP is calling upon all nursing homes to be transparent and open with the residents, the families, the staff, and the public about how they are combating COVID-19 by calling on our state officials to share that information with the public, asking Congress to allow for virtual visitations and more. Please know that AARP is advocating for you and your loved ones, and we will continue to do so. At AARP, we understand that caring for a loved one, whether together or apart, is tough right now, and we hope that these tips will help provide some guidance and comfort to help you get through it. Can you please go to slide 6? Another thing that we have are plenty of resources. We've gathered our best resources, and you can see them on screen right now. For all of our caregiving needs, we have 2 very important websites. One is aarp.org/caregiving, and in Spanish, aarp.org/cuidar. This site contains all of the information related to caregiving that you would need to help your loved ones. To stay informed on everything coronavirus, these websites are updated daily, real time, with information on stimulus, telehealth care, mental well-being, and so much more. And those sites are aarp.org/coronavirus, and in Spanish, aarp.org/el coronavirus. We also recommend that you check out our AARP Community Connection page, or AARP Mi Comunidad. Here you can find mutual aid groups in your area, made up of volunteers helping those in need, from picking up your groceries to lending emotional care to neighbors. So you can find out more at aarpcommunityconnections.org, and in Spanish, aarp.org/mi comunidad. Another excellent feature, because we cannot encourage this social isolation, we have to help. We have in the Community Connections program a friendly voice, La Voz Amiga, which allows users to ask an AARP volunteer to call and check in on loved ones. There are 2 toll-free numbers. The number in English is 888-281-0145, and in Spanish, for La Voz Amiga, it's 888-497-4108. So these are just a few of our resources that we have available during this challenging time, and we encourage you to please visit them and share them with your loved ones so that you can really, really help and stay informed. And remember that real-time information is available on aarp.org/coronavirus, and in Spanish, el coronavirus. So let's look out for each other. Let's be allies to our communities, our neighbors, our family members, our loved ones, and those under our care. Now is the time to connect, even while we're apart. No matter how difficult the road is ahead, we have the resources we need to keep positive. And let's remember that we're all in this together, y que juntos es posible. I am Yvette Peña with AARP. Muchas gracias, and please be well.
Thank you so much, Yvette. And thank you to all of our speakers for informing and educating our audience on COVID-19 and health research. Let's begin with the question and answer session. Again, for our participants, if you have questions, please use the question and answer box at the bottom of your screen. The first question we have is, given that global aging is occurring in most countries, and as expected, there will be future epidemics and pandemics, the elderly are most impacted when these occur. What initiatives should be proposed within the Older Americans Act, CDC, NIH, and states to protect older adults in the future? So it looks like more of a policy question.
Yeah, it is a policy question. Probably Bob would be the best one to really answer that for us. I know the activities you're doing, but I would just add, and then I'll turn it over to Bob, that age-friendly approach, we need to ensure that the key concepts are included in some of this policy. But over to you, Bob.
Thank you. Well, I'll say hello even before my time here. Let's just say that there are several things that we must look at in a policy framework. One is we need a greater investment in public health than we currently have. We need to strengthen the Older Americans Act, particularly those programs that are, by their very nature, contributing to lowering social isolation, like our nutrition programs. And happily, we've had a renewal of the Older Americans Act just signed into law recently. And Congress is providing significant amount of money through the emergency bills for the Older Americans Act programs. But we have to look now and all downstream about what's going to be happening. And everybody in the advocacy framework, from AARP to the Hispanic Council and everybody else, is working to get the right resources into the right places at the community level to help older adults.
Thank you. Next question. Regarding mental health, I have clients, I make wellness check calls, that are having a difficult time dealing with their children's social distancing and not visiting them as before. Any suggestions as to what I could say to help them? Most do not want to seek mental health assistance.
You know, that's very, very common. And especially in the Latinx community, there is quite a bit of stigma that can be associated with looking to resources and being seen as showing that there's weakness or that we don't want to address that. I think one, and the individuals asked this question, I think it's a great question, and they may be already addressing this, but if you have, and I have the permission or are able to, I would first reach out to the family members and let them know that though they can practice the spatial distancing, and they obviously want to take care of themselves, because Yvette made a great point. We need to take care of ourselves before we can take care of others. But is to go ahead and see who in the family would be willing to still stay connected. You just got to make a phone call. Would you be willing to write a letter to the elder who's the one that really needs to have their family stay in touch with them, emphasizing really the importance of that our overall health really does include our mental health within that context, and really emphasizing more maybe the physicality of mental health, which is letting them and helping them to stay informed about the fact that, you know, staying active, taking your medications, addressing your physical conditions, chronic that you're dealing with, also are very tied to, in fact, our mental health, and go both ways. I don't know if you could try even using maybe even some science. For instance, there's really good research that shows, for example, individuals dealing with cardiac events, say like a heart attack or has had a stroke or something, that if we don't deal with the depression, it actually makes things worse, and vice versa. So helping to educate, you know, like I said, using language respectfully, not condescending, to help them understand the connection of why those are important. But if you have to emphasize more the physicality of things, what we call somatization, which is often what we do, especially in the Latino community, when we're anxious or even when we're depressed, we concentrate more on the physical manifestations of our mental health, such as an upset stomach, or you have aches and pains, or you can't sleep. You can go from that perspective and address those. But also, like I said, trying to definitely find what are the different ways that maybe to keep them and their family connected, and remind them or see if there are other friends or associates you can reach out to, sort of to find allies to be able to help out. But I would like to hear what Yvette might be able to offer, because I know HARP has been dealing with these issues for a very long time.
Yes, Dr. Martinez, absolutely. And, you know, one thing that we've encouraged, I mean, that is why we have the, you know, the community connections, and we've set up the call. You know, social isolation is something that is so prevalent even before COVID. And what we want is, you know, if family members are not calling, that they have a number to call. I gave out, you know, the information on the numbers, these mutual aid groups where they can get, you know, they can get the groceries picked up, they can get their pharmacy prescriptions picked up. But I think it's also very important too. I think the power of the internet is just incredible, really making sure that the family member is connected. I cannot tell you, when I FaceTime with my older tias in New York, how wonderful it is and how great they feel to see a smile, to see somebody different, you know, to see somebody that's not in their home. I think it makes a difference. Good old picking up the telephone. It's so important now more than ever, even if you call them once a day, but for them to hear that friendly call, you know, recommend if they're good programs on the phone that are not CNN, that are not MSNBC, that are not so COVID focused, that are a little bit lighter. I think levity right now is so important, keeping our family members in tune. But I think that connection via video, a phone call, letting them know, giving them resources, letting them know, you don't have the internet, why don't you call here? You know, the numbers that I provided, Dr. Martinez and everyone, also have people in Spanish so that they can talk to them. And they're available at all different kinds of times. So there's a lot of ways to stay connected, because social isolation is a real thing. It leads to depression, and it also leads to disease, as you well know.
I would add one thing. The intergenerational piece could be very creative, where maybe you have an older daughter or a son of an elder, but you might be reaching out to the grandkids, or even there's some great grandkids, and they can do a really great job of shaming us to do the right thing. So don't forget about maybe the intergenerational approach to keep the family connected.
Okay, so I want to get to 2 more questions before we wrap up. From Freddie Perez, I work with the Christopher and Dana Reed Foundation, and the population we work with are individuals living with paralysis or a physical disability. Is there any research being done or new information around those living with a disability and their unique needs as it relates to COVID-19? Also for Dr. Martinez, are there unique tools and tips for this particular population related to mental health? So
Well, Christina, I
specifically,
think the first question, I think that was for our researchers that presented earlier.
yeah.
For the second question, I think that's an extremely relevant one. Usually, I would what I would do, I would look to the resources, and I would actually be looking to NAMI or to ARP myself to see if they have any already established protocols that we can, us that are in the behavioral health community, can hook families up with when they're those especially that are dealing with either paralysis or quadriplegics that really need those kind of services. So unfortunately, I don't have it on the top of my head of who we would reach to, but I would be looking to the resources in your local area, especially schools of social work, but also 211 and others. And I would see if I would turn to my colleague Yvette Benya and see if she knows of any that could be very helpful for this individual, because it's a great question.
You know, off the top of my head, I do not, but I'd be more than happy to go back to our chief medical officers at AARP. We have so many doctors on staff to be able to manage that. So if the NHCOA team can capture that, I'd be more than happy to take that back to our medical team at AARP.
Perfect. And apparently, because I used the last asker's name, people are now asking questions anonymously. So an anonymous question. In regards to the All of Us program, can anyone participate, or does it have limitations? That's a great question. All of Us is open to everybody, and they really want the diverse populations to participate. So the limitations, I do believe, are that you have to be age 18 and over. We are very fortunate to have our engagement counselor, Rima, is on with us. So if I misspeak, please correct me via the question and answer box. But other than that, it's open. They highly are seeking diverse populations, all age groups to participate, and have created materials in a wide array of languages to make sure that it is accessible for many populations. And then next question, are there support groups by trained mental health specialists, psychologists that maybe meet via Zoom that you're aware of, and can you suggest those resources if you know about them?
You know, that's a great question. I do know of some, but they would be local and here to Central Texas, because I'm here in Texas. As an example, there's a Latinx Chicanx Behavioral Health Network that if you were in this area, I would say connect with them. It's a network of our local psychologists, social workers, psychiatrists, child innocence psychiatrists, geriatric psychiatrists, geriatric psychologists. I mean, the list goes on. Psychiatric nurses that are all a part of that network that are available and want to work with the Latino Hispanic community. There's even also an African American Austin-based health network as well. But I don't know of anyone that's national that they could touch into. That might be something that maybe you know about on a national stage.
Yeah, you know what? There's a foundation, the Hispanic Heritage Foundation, led by Antonio Tijerino. They have been doing a series of charlas on many, many different topics, mental health, well-being, and they are so helpful, so casual, and they do have a lot of experts. So I would recommend that you go on the Hispanic Heritage Foundation website and take a look, because the charlas are happening pretty often, and that's one that I've also participated in, and I know that they're very well attended and very well informed. So I recommend that you take a look at that one. That one's the one that I know offhand that does drive national topics in a national audience.
And I did recall the Substance Abuse Mental Health Services Administration. If you go to their website and you can click on there, they do have resources that are for different cultural groups, and especially the Latinx. And within that, the drop-down menus that they have, they should have resources that are national as well that you can use. So that's the Substance Abuse Mental Health Services Administration. You can just Google that.
And one last
And
thing.
perhaps this is,
Oh, go ahead.
I was going to say, this is Yanira, Cruz. I just wanted to say one of the things we can do in the very near future is put out a blog that looks at those resources and make it available for everyone. So that's a commitment that we can make to do the research ourselves and put a blog together for some of those ideas that have been voiced already, but also others that are out there that can be helpful.
And then just one question. I know I said only two more. But does AARP have specific resources available related to caregiving during COVID-19? And are those available in Spanish and on your website?
You know what, I will tell you one thing that I'm very proud of is how AARP is doing everything real time in Spanish. And so for everything that's COVID related, we have aarp.org, diagonal el coronavirus. Everything that is available in English is available there in real time. And then if you want to get specific onto caregiving, aarp.org/cuidar has everything you would need on caregiving. But there is so much information. And then the one that I think is so important because of the social isolation is at AARP Community Connections page. And the Spanish equivalent of that is aarp.org/mi comunidad. And the number to get that voz amiga, that person to call you if you want somebody just to talk to in Spanish, is 888-497-4108. But thank you so much for that question. And the answer is yes, real-time Spanish language information para nuestra comunidad latina.
Thank you so much. And thank you to all of our panelists. Oh, Dr. Cruz?
I was going to say, Yvette, can you repeat that number?
Sure. The number is 888-497-4108. And that is La Voz Amiga, the AARP.
Thank you.
You're welcome.
I am putting that in the chat box for everyone to see. So again, thank you to all of our panelists and our participants. Before ending, I'd like to introduce Bob Blancado to provide some brief remarks about today's Tele-Town Hall. Mr. Blancado is a member of NHCOA's Board of Directors, and he is recognized as a national advocate for older adults and a policy expert.
Thank you, Christina. Thank you very much, Christina. And as a new board member, I'm very proud to see what happened today. I commend NHCOA for holding this Tele-Town Hall meeting, especially at this time. Dr. Cruz, congratulations for taking the initiative on this. I want to commend all the speakers, Dr. Carrasquillo and his talk about research, and Dr. Ibarra speaking about the work of pharma and the importance they're doing. My friend Dr. Martinez focusing on the key issues of isolation and the importance of communication and mental health. And of course, my colleague, Dr. Pena, and the work of AARP on family caregivers and that very important information about nursing homes. I think that's very important that we get that information out there. So as we can all see, we're gathering in a time like no other in our lifetime. The coronavirus pandemic is putting our nation to the test. It's testing our capacities and our compassion. And there's so many components to this crisis, economic and healthcare. But we should take a moment to salute the women and the men who entered the field of public health and healthcare and direct services, who are providing selfless services every day in this country. And salute the many, many volunteers in our country who are helping older adults, including many people I'm sure who are on this WebEx today. But most importantly, at this difficult time, as we focus on getting along day to day, let's remember how important the caring side of all of us is. Let's show it in any way we can. Let's show it often. And as the saying of the day goes, we can get through this together. So I close with a thank you for joining and a sincere wish to stay well and stay safe. Thank you.
Thank you. We'll have a few remarks from our president and CEO, Dr. Cruz.
Thank you, Christina, and thank you to everyone for speaking and making time to be here today. Wonderful presentations, I think very much needed by all of us, and just wanted to remind all of us that we're holding this Tele-Town Hall today as a way to stay engaged with our community, connected, and give accurate and up-to-date information to our Latinx community across the country. I know we have a very robust participation today, and know that we will continue to do this type of connections and town halls, Tele-Town halls throughout the next few months. Our next one will be in Spanish, only in Spanish, and we'll highlight some of the very similar issues that we've touched on today. That will take place on April 29th. So please share that information with others. And just to share briefly some of the things we are doing at the National Hispanic Council on Aging to address this pandemic. First of all, we are putting out in blogs and informational pieces regularly, almost daily, in both English, Spanish, and also in Portuguese for some of the Portuguese-speaking communities that don't have access to information. So we are putting out information pretty regularly on different topics. We invite you to stay connected to our social media or sign up for our newsletter so that you get our communication regularly. We're also communicating with Congress to provide a voice and a perspective on the situation with Latinx older adults and caregivers, so that the responses that we get from our legislators are in sync and in harmony with the realities of our communities. As you know, we have housing facilities, and we're very, very concerned about the older adults in general. We're also very concerned about older adults living at Casa Iris and Miravista. We are offering in some areas some nutritional support for our older adults. We're also offering support with grocery shopping and with medication shopping for some of the older adults that where we can have an impact. So we just signed a new partnership with Univision. So you will see us more out there with regards to getting information out to the Latinx community in terms of prevention and managing this pandemic. And finally, I want us to just be thoughtful about our brothers and sisters who have been impacted personally with the virus, and to keep them in our prayers and extend a helping hand so that we can provide them with a word of encouragement and support. I know sometimes we can be biased against them, and so that is not helpful to them. So I asked all of us to build that sensitivity among those individuals who have been infected with the virus. So, and lastly, again, I just want to say thank you to all our speakers, Dr. Carrasquillo, Dr. Ibarra, Dr. Martinez, Yvette Peña, Bob Blancaro, and of course, our moderator, Christina Pacheco. So thank you to all of you for joining us. Stay healthy and stay safe.
Thank you, Dr. Cruz. And again, thank you to our attendees and our experts. Remember, you are not alone and we are all in this together. Have a good afternoon.
Hi, everyone.